you could change just one prescribing habit in pediatric clinics worldwide, what would it be?
Stop prescribing antibiotics for uncomplicated viral cough or colds.
Is antibiotic overuse in bronchiolitis still a problem in many pediatric wards?
Yes, despite guidance, antibiotics persist without bacterial signs.
Is the gut microbiome a potential ally in the fight against antimicrobial resistance?
Yes, preserving it supports immunity and reduces unnecessary antibiotic exposures.
Hello and welcome to the EMJ podcast with me, your host, Dr. Saranya Ravindran. I'm honoured to be joined today by Susanna Esposito, full Professor of Paediatrics at the University of Parma and Director of the Paediatric Clinic at the Pietro Barilla Children's Hospital of the Parma University Hospital Trust in Italy. Professor Esposito is also President of the World Association for Infectious Diseases and Immunological Disorders. She is one of the world's most cited experts in pediatric respiratory infections, meningitis management, antimicrobial stewardship, and the role of the microbiome in disease. Her work has shaped global guidance on rational antibiotic use, respiratory virus treatment, and vaccine implementation strategies. Professor Esposito, welcome. It is a real pleasure to have you with us.
Thank you very much. It is a pleasure for me to be with you and for your invitation.
So, to start with, we are going to do some quick-fire questions. So, what is the most frequent misdiagnosis that leads to unnecessary antibiotic use in children with respiratory symptoms?
Viral upper respiratory tract infections mislabeled as acute bacterial sinusitis or acute otitis media. Antibiotics don't help and aren't recommended.
And what's the biggest red flag that an infection might be bacterial rather than viral in children under 5?
Persistent high fever with focal findings like lobar consolidation, otitis media, dysuria, and no clear viral prodrome.
What's the most important factor in deciding whether to start antibiotics in a febrile infant?
Pre-test risk of serious bacterial infections based on age, appearance, and also on initial labs. Treat promptly if high risk.
If you had 10 seconds to explain antimicrobial stewardship to a parent, what would you say?
Antibiotics aren't fever medicine. We use the right drug, the right dose, and time only when bacteria are likely, so they work when truly needed.
What's one breakthrough in diagnostics or surveillance you'd like to see in every pediatric hospital?
A rapid multiplex point-of-care PCR panels that distinguish common viral and bacterial causes and shorten or stop unnecessary antibiotics.
If you could change just one prescribing habit in pediatric clinics worldwide, what would it be?
Stop prescribing antibiotics for uncomplicated viral cough or colds.
So, for some yes or no questions now. Can high antibiotic use in early childhood impact vaccine response?
Yes, because newborn exposure can blunt antibody responses to routine vaccines, likely through microbiome disruption.
Can inappropriate antibiotic use in infancy contribute to future allergy or asthma risk?
Yes, there is an association. Multiple analyses link early exposure with higher childhood wheezing and asthma risk.
Should macrolides still be used routinely for community-acquired lower respiratory tract infections in children?
No, reserve for suspected atypical pneumonia. Amoxicillin remains first line.
Are shorter antibiotic courses as effective as the traditional 10-day treatments in children?
Yes, for outpatient community-acquired pneumonia and some SSTIs, 5 days often works and reduce the risk of adverse events.
Is antibiotic overuse in bronchiolitis still a problem in many pediatric wards?
Yes, despite guidance, antibiotics persist without bacterial signs.
Is the gut microbiome a potential ally in the fight against antimicrobial resistance?
Yes, preserving it supports immunity and reduces unnecessary antibiotic exposures.
Thank you so much, Professor Esposito.
Thank you for the invitation and for the questions.
And that wraps up this Quickfire episode. Stay tuned for our upcoming deep dive conversations where we'll explore this topic in much more detail. Thanks for listening.